Hi, hello, welcome back to our channel. So today we are going to discuss about balanced occlusion. So when it comes to balanced occlusion, it's a vast topic. So we are going to construct it and explain it in a easier manner so that you can understand basically what is balanced occlusion and what are their requirements. So come, let's go into the topic today. So before going into the video, we are producing bamboo toothbrush which you can gift for your lovable ones or you can use it for your own use, and you can now purchase it online and the link is in the description, where we have WhatsApp link which is directed to the catalog and you can purchase it from it. So when you're checking the description, don't forget to click the like button. So come, let's go into the topic today. So for balanced occlusion, we have definition and we have to write the definition as it is. We are not supposed to change the definition. So for our understanding, what is balanced occlusion is, in our natural tooth, we don't have the necessity to have contact between the upper and lower dentition. But when it comes to artificial tooth, we are supposed to have a upper and lower contact for the balance. And eventually when it comes to a human body, the foreign particle, it tends to push it out. So eventually the denture is trying to tip. So we have to prevent that. Along with there are chances of tipping of the denture while masticating, while overloading, while swallowing, while talking or speaking. All these periods we have increased chances of tipping of the denture due to the muscular movement. So in this case, we have to manage somehow to make the denture fit in the arch. So we have to go for balanced occlusion. So when it comes to balanced occlusion, the things we have to consider is, so when we arrange the tooth, it should be slightly arranged lingually so that we get the ideal balanced occlusion. So when we arrange it buccally, there is some compromise in the balanced occlusion, because when we masticate, the force which we apply on the tooth is directly goes to the tooth and not evenly spread. So when we arrange it lingually, the force is applied straight to the ridges. So the ridges, what they do, they evenly spread the force applied on the ridge. So we have four types of balanced occlusion. One is the unilateral balanced occlusion, and the other is bilateral balanced occlusion, and protrusive balanced occlusion, and the lateral balanced occlusion. So unilateral balanced occlusion is something which the artificial tooth glides smoothly on the opposing tooth. So this is not eventually used in complete denture. It is used in the fixed partial denture. Bilateral balanced occlusion is used in complete denture, and this occlusion is seen in both the sides and in centric and eccentric positions. This helps to distribute the force evenly across the arches. So minimally at least 3-point contact should be maintained. More the contact, more the balanced occlusion. So how much ever contact is possible we can place, if at least minimum of 3 contacts should be maintained. Protrusive balanced occlusion, where when we protrude the mandible, there should be minimum of 3 contacts, where 2 in the posterior and 1 in the anterior. So that will maintain a good balanced occlusion. So where this contact is absent in the natural tooth. So when it comes to lateral balanced occlusion, we have to have minimum of 3 contacts, as I said before, and that will be absent in the actual tooth or natural tooth. So when it comes to tooth arrangement, when we are arranging the tooth according to the canine guidance, when we shift our mandible laterally, there will be no contact, or there will be only the canine which is contacting on the opposite side but not on the working side. So eventually there is a compromise in the stability. So when it comes to tooth arrangement, we have to arrange in such a way that all the tooth is in contact when there is a lateral shift also. So finally, how we implement the balanced occlusion, only when we know how we implement, we will be understanding the balanced occlusion, why we are doing all these stuffs. So how to achieve the balanced occlusion? So what is actually the balanced occlusion? So when it comes to your procedure, the step 1, you take the impression and you do a wax up, and when you are ready with the wax up, you go for try-in. So when you are going for the wax trial, we have to place the wax inside and get the condylar occlusion and the incisal tip measurements and how the condyle glides. All these things we will be checking, and we will be reducing the wax pattern according to the individual, and we will be taking a bite, right? So when we are taking the bite, there comes the first step of the balanced occlusion, because when you are taking the bite, you are recording the condylar measurements and condylar movements. So when that comes in play, we will be recording the patient's condylar into the your articulator. So when you are bringing your bite pattern to the articulator, you are recording the condylar path along with the incisal guidance, where the how the incisal is placed and aesthetically how it coincides with the patient. All these things you are recording and bringing to your articulator. So now you have got the basics of the occlusion, where we will be tying a knot from the condyle. Like in your articulator you will be having a condyle guidance, right? So from there you will be tying a thread along with the incisal guidance, and you will be taking it to the other side. So that along that line you will be placing the bite pattern. So when you are placing the bite pattern in such a way, you are recording the condylar path and the incisal guidance in your articulator. So that brings the basics of the balance occlusion. So basic requirement you have brought to the articulator. So with that you are going to place your upper tooth. So where you are going to place your tooth in the order where we have the principles of tooth setting, which we have already explained. The link is in the description. You can check that for principles of placement of the teeth. So according to that, if you place the tooth, that will bring up the second step of balanced occlusion, where you have to check for the contacts in the glass slab, where you can check for all the contact of the tooth to the glass slab, so that that will have the contact with the mandible when you bring it to the patient's mouth. So you are checking your contact with the glass slab, and again you are going to place the lowers, where even the lowers are going to glide along with the maxillary tooth. You are creating an arch from the condyle, and you are having a good balance occlusion. You are creating a good balance occlusion with the patient's mouth, and along with it you have to reduce the excess amount of extension of the denture, so that that won't affect the patient while swallowing. So we can prevent tipping of the denture while swallowing, and we have to record the retromolar pad properly, so that that seating will prevent the displacement of the mandible. So when it comes to incisors, the incisors are placed in a perfect overjet and overbite, so that even there we have a little bit of contact, and it resists the mandible to tip out, and it will resist the maxilla to tip down. So even the incisal, we have the necessity to place in a proper manner to bring the best out of the balance occlusion. So the curve which is formed naturally is called the curve of Spee, and that is more essential for the balance occlusion. So if you like this video, please do like, share and subscribe to this channel, and much more videos are coming up for you.